Hello viewers, welcome to my channel Dr. Ghosh Presents. Myself Dr. Surajit Ghosh, creator, speaking to you from Kolkata, India. Today's discussion will be on jaundice. Caption being, can liver cirrhosis or liver cancer result from jaundice? We all know that jaundice is a disease where eyes, nails and even the skin too turn yellowish. In fact, jaundice is just a sign of disease, commonly known as hepatitis or inflammation of liver. Liver is situated below the right rib cage in upper part of abdomen. What is hepatitis? Liver is made up of millions of cells called hepatocytes. Inflammation of those cells is called hepatitis. Inflamed liver cannot function properly, so signs and symptoms appear. Depending upon the nature of causative organism, symptoms as well as damage to liver may be severe or minimal. What are the causes of hepatitis? Number one, main cause, viral infection by hepatitis virus A, hepatitis virus B, virus C, virus D and virus E. Other causes, non-infective, from drinking alcohol, it's called alcoholic hepatitis, from derailed immune system, it's called autoimmune hepatitis, C, from medicine, drug or toxins, called toxic hepatitis. A few most important information regarding liver and hepatitis. 1. Man cannot live without liver. That is, it is an indispensable organ. This is the gland and largest solid organ of the body, weighing about 1.5 kg. It has got two lobes, right and left, connected by ligament. It is our only organ that can regenerate itself. That is, if a portion of liver is cut off within a reasonable time, it will be complete liver as it was before. It performs about 500 different functions in our body. 4. Liver filters out toxin from our body. To perform this function, it is often gets seriously damaged. So a person with 100% liver, healthy liver, is seldom seen. After birth, toxins enter our system with foods, drinks, respiration continually. 5. Along with bile, liver extracts out bilirubin, cholesterol, hormone and extra medicine or drug from our body. 6. Extra glucose of our body is stored as glycogen in liver, which again transform into glucose at the time of the need of extra energy. 7. Liver stores vitamin A, D, E, K and vitamin B12. In a few cases, it stores vitamins as backup for years together. 8. Alcohol and drugs are the pitched enemies of liver. By stopping alcohol and drug, one can reduce probability of hepatitis by 80%. 2 pictures have been shown. On the left side, normal liver. On the right side, liver with cirrhosis, that is a very malignant disease, cirrhosis of liver. Look, the picture of the liver, the whole surface has been gritty. This is dangerous and malignant disease. 9. From analysis of World Health Organization Global Burden of Disease Studies, an international group of researchers disclosed that from consideration of number of deaths caused by infective diseases, at present viral hepatitis has come to the same rank as that of tuberculosis or AIDS. In 2018, viral hepatitis caused about 1.5 million deaths in the world. Number 10. A senior member of the group referred to above opined that most of the cause of death was infection from hepatitis B or hepatitis C viruses. Acute symptoms of the infection disappears first during treatment. Patients think that they are cured and stop follow-up. Not much later, when the disease turns into a case of liver cirrhosis or liver cancer, they exclaim. "11. In fact, jaundice or hepatitis may easily turn into a case of liver cirrhosis or liver cancer, especially if the cause behind jaundice is a virus or too much alcohol or other severe toxin. Then the disease may be a wolf in sheep's clothing in many cases. If you are a patient of jaundice, do not forget to request your physician to prescribe for pathological examination to detect the cause of jaundice. Do not stop treatment without permission of your physician, especially if you are not vaccinated. Please mind that a stitch in time saves the nine. While in health, a person's stool is burnt yellow in color and urine is straw colored. But during jaundice hepatitis, the same person's stool is ashy and urine is deep brown color. Why? While in health, bile secreted by liver comes down and mixes with half-digested food in duodenum. Pigment bilirubin of the bile makes the color of the stool burnt yellow. During jaundice, bile is not secreted by liver, so bilirubin is absent in stool, thus color of stool becomes ashy. Since during this time bilirubin accumulates in blood, so various parts of the body become yellowish, and the filtrate coming out from kidney, that is urine, is full of bilirubin, making urine deep brown. What are the signs and symptoms of acute jaundice? Number 1, pain in abdomen. 2, loss of appetite. 3, nausea. 4, tiredness. 5, eyes, nails, skins get yellowish. 6, loss of weight. 7, urine dark colored, stool ashy. Signs and symptoms of chronic hepatitis are so slow to appear that they are imperceptible, but liver function test shows grave changes of hepatitis during this time. Take absolute care if it is so. How to prevent hepatitis? 1. Vaccines are available for hepatitis A and B. Vaccines for B works for hepatitis D too. Hepatitis C has no vaccine. Whenever possible, get these. They are very effective. For person infected with E virus, enough rest, adequate fluid intake, light nutritious foods, and stopping of alcohol are commonly sufficient to cure. Number 2. Wine and other addictions are top foes of liver. Stop this and chance of hepatitis would be lowered greatly. It has already been told. Number 3. Whatever we took as foods and drinks are processed by liver. If foods are simple, liver can tackle them easily. So complex things like refined sugar, salt, saturated fat, ready food drinks damage liver. Besides, there are a lot of mycotoxins in medicines, ordinary food drinks. They too damage liver cell. Even toxins absorbed in the blood from smoking harms liver. So take absolute care to keep liver healthy. Number 4. Pure water is a good friend of liver. Take 2 to 2.5 liter water per day. 5. A lot of micronutrients and antioxidants are there in fresh veggies and fruits. These are very liver friendly and preventive to hepatitis. A few of these are shown below. All citrus fruits and veggies, all berries and grapes, especially reddish black, papaya, lemon. Carrot, beans, beet, turnip, pumpkin, sweet potato, tomato, broccoli, cauliflower, spinach, avocado, olive. Whole grain fruits and veggies are so helpful to our body, equally dangerous as refined processed grains, fruits and veggies. Healthy fats, minerals, vitamins, antioxidants and other micronutrients are abundant in whole food items referred to above. These are liver friends. Nuts, beans, types of food items contain profuse vitamin E. They are too liver friendly. What foods and drinks should be avoided altogether? Wine and all other addictions. All types of refined carbs like maida, pasta, sugar, etc. all bottled, canned, packet foods and drinks, all foods with saturated fat and trans fat, all types of red meat. In this figure, shown that lean meat is better than red meat, but mind it, sometimes no meat should be allowed. If meat allowed, then lean meat is okay, but when meat is not allowed, nothing should be taken. 6. Raw or half-boiled fishes, fried, highly spicy, salty snacks, At last, I would narrate an experience of myself. If patients of hepatitis caused by virus B or C or alcohol take a very simple drink regularly, case cannot reach the stage of malignancy easily. I have referred to this drink in many occasions. I have used the name of anti-cancer drink in the blog first in my website www.drghoshpresents.com on 17/7/18. The name have been coined by me personally. I got the reference of this wonderful simple drink in internet. I get a lot of good result by using the same in many different types of malignant diseases. The same may be used by patients of chronic hepatitis too. Read below carefully. Procedure of making the drink. 2 tablespoonful of lemon juice or apple cider vinegar plus half teaspoonful of baking soda. Keep for 2 minutes. Then mix 200 ml of drinking water. Drink is ready to be taken. It should be taken in empty stomach 3 to 5 days a week, depending on the gravity of the case. Our presentation ends here. You have gone through the whole session. Now please give your comments as to the quality of this presentation. How this could have been much better, what should have been added, or what should not have been added. I'll be waiting for you so that I can give you my best presentation in the coming days. Thanks for the time and attention.